Welcome everyone who is here on Zoom and also to those watching on Facebook Live. I'm Bruce Shapiro, Executive Director of the Dart Center for Journalism and Trauma, a project of Columbia Journalism School in New York City, supported by the Kenneth B. Foundation. This is the latest installment in our improvised series, Reporting COVID-19 Conversations for Journalists, which we hope will be a combination of webinar, skill workshop, and coffee hour, where we can talk as colleagues about some of the challenges our profession is facing going into this unprecedented global pandemic. It's also an attempt to connect us all as professional colleagues at a time when most of us are working in some degree of unusual isolation. We're continuing today a focus that we began on Tuesday, which is looking at the particular challenges facing local journalists in this pandemic. I am really happy to be joined today by my friend Florangela Davila, who is the news director of KNKX radio in Seattle, Seattle's public radio station. She was also a longtime reporter and columnist at the Seattle Times, where Florangela had one of those bylines that you looked for because you knew you were going to see reporting of grace and insight no matter what. She supervises the 16-person team at KNKX, and our theme today is the day the pandemic arrived, lessons from America's first hotspot. We're going to be talking about Seattle journalists' encounter with coronavirus, a situation that many local reporters around the world are now dealing with for the first time. Seattle, the first town in North America to have a confirmed case, now is the leading edge of our wave on this continent, but also shares much in common with local journalists around the world. Florangela, thank you for taking the time to come. I know this remains a live story and a difficult story in your community. We're really glad that you're here.
Thank you.
Do me a favor, let's go back to a timeline that begins on January 21st. That's the day when the first coronavirus case was confirmed in Seattle, and therefore the first case in the U.S. And the timeline then moves forward to February 29th, when you saw the first death in Seattle, and therefore the first death in the U.S. How did that first case in January, the news of that first case, change your newsroom?
So thanks, Bruce. Like everybody, we had been tracking the story out of Wuhan, and we were all curious. And when the first case came, it was there. We reported it. We were watching it, and we actually didn't go into full on, full court press yet. It was one case. We were curious about the individual who was up north of Seattle. We were lucky that at the time we had a freelance health reporter on board, so he was minding that. So that's probably the biggest lesson, is the ability to have had somebody on board who had some expertise. Mm-hmm. Everything changed when, fast forward for that month, and we got a phone call at like about 8 o'clock at night. And that same reporter pinged me and said it was unusual that Department of Health was going to have a press conference in the evening. And the next morning, that's when we went, we got a heads up, and the next morning was when that death was confirmed in the healthcare center. And then from then, life has been very much like life is now for all of you. Kind of overwhelming, full court press, everybody on board, and then slowly moving into remote working. Mm-hmm. I think the thing that is challenging is being at the mercy of authorities at all different hours, and sort of a lack of clear information coming from one source. So this was outside of Seattle. It was in a suburb. had a separate jurisdiction. Then the state came in. There were all these different players happening. And I think we see that at the national level with a lot of questions and wanting some basic information about capacity and equipment. I think we're feeling that as well. But that's where we all were. We're a small newsroom. We have about 14 people now on the story. We switched, we had a podcast team that moved over to Daily News and also launched a podcast about transmission, a call transmission about the virus.
And we'll talk about that in a few minutes. I want to talk about that specifically. Yeah. Let me just say, first of all, to everyone who is here on Zoom and on Facebook Live, Florangela and I will talk for the next 15, 20 minutes. Then we'll go to questions for another 20 minutes or so. And the way we're going to do that is take your questions via chat. So if you are on Zoom, you can use the Zoom chat feature at any point here to zing in a question. And I won't be able to get to all of them, but we'll get to those that we can. If you're on Facebook Live, all you can do is lurk and listen, I'm afraid. But that's how the conversation is going to go. Florangela, as a smallish community radio station, medium-sized community radio station, you have to choose priorities in this story that is becoming huge. As it grew from that first case to the first death to where we are now, what has your team made your priorities, and how did you decide that? What's been the conversation?
So from the first death, when we had one reporter who was a public health reporter on that, when the cluster became a thing at the nursing home and it became a national story, everybody switched gears and it became coronavirus all the time across all beats. The challenge, I think, for us is getting up to speed aggressively on the science and the capacity issue, basic numbers. But also we have a pretty large region, and I was actually pulled out a map because it's probably no different than, but this is, this is our listenership goes all the way down to the Oregon border up to Canada. So how do you cover and get ahead of including those voices who had some of the same questions? Certainly, we started realizing that there were going to be so many different press conferences happening. So we quickly deployed people there. This was before we went remote. But everybody switched. Our environment reporter switched onto that beat to look at like food issues, grocery workers. We had the public health reporter. We have a person who covers homelessness. And so he's now looking at vulnerable communities. We had somebody who was interested, who had been covering criminal justice. So she took an interest in Department of Corrections and some of those populations. Tribes was something that our environment reporter also looked at. And then certainly schools, because that was the big question as to what was going to happen. And again, this is all happening as the first wave is hitting. This all seems kind of normal now, but it was, you know, as more and more measures were being taken place on safeguarding the population, then it became more and more apparent that we were going to be staffed, trying to staff over the weekend and certainly during the longish hours. The thing that is probably similar to a lot of newsrooms on a small level is we were not prepared to work on the weekends. Like we don't have backup editors. We have our reporters. Everyone was kind of wearing many hats. And two, we weren't ready to be able to work from home. We just, you know, we're a dual format station. We have our newscasts and then we switch to morning. On the weekends, we have music. So getting everybody in that sense to be aggressive and having to cover the story. At the same time, the anxiety that we are all feeling now escalated so aggressively that it intersected with just kind of the emotional well-being of the reporters.
And how did, and that leads to a couple of interesting questions. One is what steps did you take to protect the physical health of your team? What became the norms? How did that evolve? And how have you thought about the stress, the emotional issues, and so on that emerge on your team? What have you seen and how have you handled it?
So the first thing probably was just cleaning the equipment. in the studios and just
Mm.
trying to scramble to figure out how you do that, because we cannot operate if we don't have hosts, and our hosts have to physically come into the building. So that has always been the case. We were prepared basically from having to face snow days.
Yeah.
When the city shuts down, the hosts still have to be able to get into the building. So on that level, we were prepared. What we weren't prepared for is, as more and more information was coming out about contact, how do you sanitize quickly and keep, when people are using the same microphones, for example, in the boards. So there was that. For a while, our health reporter, who's now on contract to NPR, but he was based at our station for a while, he was going to the press conferences at the nursing home center. He was like, there was just a pool of reporters, and a lot of people were still plugging into the board. It hadn't quite hit yet that that was probably something to be careful of, because healthcare workers were still going in. The level of protection now is our hosts are, being meticulous about cleaning everything before and after. We are all working from home. There's very little field reporting happening right now, to be honest. We're following what NPR's guidance is, it's up to the individual reporter if they feel comfortable or not. We're very happy using phone tape. That said, there are a couple of people, the homeless reporter I was telling you about, Will James, is going out into the field, and I have asked him and pretty much told all reporters, if you're going to go out into the field, you must carry hand sanitizer at all times. And if you want to use a boom, then we'll get you one. We don't have them currently, but to use at least a shotgun. So a shotgun mic, hand sanitizer. And then I was just talking to Will yesterday, and he's taken off his shoes and pretty much taking all his clothing and throwing them into hot water every time he's out in the field.
And what about those hospital stories? Certainly in New York now, as the caseload is growing in New York's hospital system, we've seen some remarkable reporting in the New York Times and elsewhere, interviews with doctors, video inside the hospital. You're a radio station, so you're not going to be doing video so much, but how have you handled sourcing those kinds of frontline and community impact stories, whether it's doctors, patients, communities, anybody?
We were a little lucky in the sense that we had an impending strike regarding nurses at some of the hospitals here. So our health reporter was already plugged in to some of the workers. Seattle is full of has a lot of hospitals, has big research universities. So one of the key members of our podcast team, Gabriel Spitzer, he had connections on that element on the scientific front. So we had sources on that. And certainly social media has been great in giving us leads on people who have different stories, either frontline workers or folks connected to various nursing homes. You can imagine that when that story took off at the nursing home, that was the question, is what is happening in other nursing homes in the area, and that's kind of where we turned our microphones as well.
And how far were you able to get to uncovering the scene at other nursing homes? How effective were you able to be on that?
I think we could have been stronger. Certainly Will Stone, the health reporter, did get some access and insight into life care. He got a great interview with a woman who had pulled her mother out, didn't want her in there anymore. Some other folks were in that same situation, that they weren't ill, but they were concerned about being in such a small environment. And so we've had some interviews on that. Our podcast team had an interview like that. And certainly that's what we're focused on now, is the frontline workers in the hospitals, getting hold of nurses and doctors.
You're not just a kind of breaking news gathering operation. The station is very much a community institution. And that, I think, has led to some particular choices, including your transmission podcast. Talk a little bit about that, why you pulled it together, and how it strikes me that it's taking particular looks at marginalized populations, homeless people, and other things. Talk a little bit about your strategy for the podcast as distinct from the sort of breaking news coverage.
Sure. Thank you. So as you all probably know, newscasts are very small holes. They're about 2.5 minutes long. We sometimes can put features for about 4 minutes or so and package them along our top of the hour and the bottom of the hour of our local newscasts. But two things that we knew we needed to be aggressive about was one, this is public service journalism front and center. To give people information we have one person who's our online managing editor. We don't have any engagement people per se. So one person is handling everything. One thing that we did, and if we had thought about it, we would have done earlier, was a list of resources, just a general hyperlinks of resources for all the counties that we cover, DOH, Department of Health, anything, so that people could go immediately. So in that sense, because the numbers were changing and different agencies were releasing different numbers, and the statewide numbers weren't always the same as the individual counties releasing the numbers, and that's what everybody wanted to know. Certainly people confirmed cases or possible cases, certainly deaths, and now the numbers that everybody wants to know is testing. Where can I get tested? How many people are getting tested? But the other aspect is, with such an emotional story and all the anxiety that was surfacing and what how dramatically life was going to get upended, everything from the notion of not being able to say goodbye or take care of your mother, to what's it like to be out on the streets and not have services available, to something that may seem light but certainly serious, is like, how do working parents juggle having kids at home and working from home? Those were all longer stories that we knew could be best addressed in our podcast format. Just to have 15 minutes, 20 minutes, have a theme and be able to go deeper and do what I think the stories that radio does the best, is that human voice and really getting inside somebody's head as well as somebody's heart. So our podcast team, it's a 4-member team. I think it was week 1, switched and proposed, let's just do a story about this region and life at the epicenter. And that's, they launched, the idea was floated past me on a Thursday, and by the following Friday, so 9 days later, we launched our first episode, and we are dropping episode 5 tomorrow. I think it's fast moving, but I think it serves our audience well, because sometimes we just want some space to think and hear how other people are really feeling.
What's the response been like from listeners?
The response has been strong. I think people are also appreciative that you have to, like you said, make choices and deploy resources onto things that you think really matter and are important and timely. I think it's also allowed for some questions that are not going to be the questions being asked at press conferences. Like, what do you do if somebody passes away and you can't have a funeral? Like, how do you celebrate them? We're encouraging folks to deliver as audio diaries or voice memos, so that we have that listener input. And my strategy, and I think the station strategy, has always been, the more voices you can get is most reflective. So I want our station to look and to sound like the region that we have. And that region is, it's not just necessarily, white middle class listeners. It shouldn't be. Our community is broader than our listener, frankly. And let's find ways to make sure that we are reaching out to communities and hearing their voices.
And for those of you on Zoom, I should say that my colleague Ariel has posted a link to transmission. For those of you who are on Facebook Live, you can simply go to the KNKX.org website, and transmission is linked right on the homepage, and it is a remarkable series. Also, for those of you on Zoom, remember to start chatting in any questions you may have for Florangela. We're going to go to questions from you in a couple of minutes. It strikes me also that listeners themselves, all of us, are sort of torn between a national and, to a certain extent, global political conversation, which is going on at the level of presidents and Senate and all of that that sort of national policy question and the lived reality at the community level, whether it's the lived reality of officials or the lived reality of some of the constituencies you're talking about. How have you navigated that balance? To what extent does the station engage with the national argument beyond the top of the hour bulletin, and to what extent are you keeping it local?
We have been carrying the White House briefings, and we've made some programmatic changes when they were happening. We have since, we'll continue to carry them whenever they're hosted by NPR, because we believe that the briefings are important and that there's analysis that comes with it from the national desk. So we've interrupted. We don't have a new newscast, for example, and we've broken into coverage to host. And we've broken into all our local press conferences, mostly from the governor, but not always, that the governor leading that. I think, I think what we can do and what local outlets always do is putting local voices first. And, it's localizing the national issue. And certainly, I mean, you started off talking about, and it's remarkable to see what the New York Times is doing. It's also horrifying to see the situation that New York is facing and how sobering it is. I have to say that is not the situation in Seattle. Even though we were at the beginning of this, things are not as grim as they are from what I'm seeing and reading out of New York. Or other places as well. So I think we're still pursuing that. We just had the stay-at-home order just a few days ago. We were behind a few other places. So in some ways, we started looking to other outlets, to other jurisdictions to see how you guys were covering things, because we hadn't hit that mark yet.
Have any of your teams gone into hospitals or nursing homes in the last few weeks?
Inside, I don't believe they have. And that was, back to your earlier question about how do you protect your, no one is going into spaces because that seems like that would be really risky. We don't have protective gear. We don't, the only kind of protective gear that we have, the hosts are more comfortable using gloves. So they're using gloves to run the boards. And our homeless person our homeless reporter wasn't going into shelters. He was doing interviews outside in fresh air or in encampments, practicing social distancing.
This leads to another question. My friend Mike Christie from Reuters chats in and asks and says, thanks for sharing your experiences. How have you managed any anxiety among your reporters, both those reporting in the field and those who might be working from homes but are still concerned about their health and that of their families? How have you managed the emotional impact on yourself, even, of having to manage and reassure?
Yeah, that I think is the hardest question here. This is only our second week working from home. Everyone was much, I think, relieved when we were able to get out of the building and work from home. It certainly relieved the hosts, fewer people coming in, and the possibility of bringing anything in and contaminating. You asked, and I think maybe it was week 1 or 2, where our daily news meetings started off with, let's just hear what you're doing for fun.
Okay. So you built in a certain amount of a non-demanding extracurricular debrief into your morning meetings.
It's actually only happened once, and it was early on. But I think reporters and journalists, there's that adrenaline that kicks in, right? And they're just, it's a dog with a bone, and I'm just going to go. And I think it's important for managers and editors to try to slow things down. I've been trying to have one-on-ones and checking in and going not overboard, but at least acknowledging little things, from making deadlines to pitching in on the story to an actual story. The acknowledgement is important. We also, our online managing editor pitched, and we all did a virtual happy hour last Friday
How did
on,
that go?
it went fine.
Yeah.
It was fun. We all showed up and we all had different beverages and we talked and we showed off our pets, and it was a Friday night and people were making dinner, and then it was, obviously something like this, and I'm sure newsrooms everywhere happening, it really bonds you
Yeah.
together. We weren't really video slacking each other until I think it was maybe this week, where we realized that face-to-face connection was really important. I probably should do a better job of checking in and making sure people are okay. I certainly am a little more careful and worried about the reporters who are going out to the field, and maybe a little worried too much, but I'd rather worry too much than not worry.
And at the risk of being intrusive, as a manager, what are you doing to take care of yourself in this period?
Well, I have a thoughtful husband and a dog. And right, because you have to be there and lead by example, right? That's always you can't overwork, or you should kind of set limits. I have tried to, now that it's actually in some ways a little normal, tried to shut off. The amount of press conferences has kind of slowed down, so there's a little more normalcy.
But that brings us back to a craft challenge that maybe you can share with other local newsrooms. What's been your team's experience trying to reach sources, official or otherwise, when people are not in their offices, and where maybe we didn't have their mobile phone? How have you been getting hold of folks when everybody's a little harder to get a hold of them when they're physically in place?
Social media, I think, has been great. I mean, I give a lot of, a great example is our education reporter, Ashley Gross, who, because she covers such a large geographical region, has been able to really connect with teachers and childcare folks and people who are delivering food. I think mining social media these days, and what I have appreciated is all the feedback, especially on Twitter, with the acknowledgement of reporters and all the work and the thanks. It feels very easy to just ask. We have asked, do you know anybody in this situation? Can you connect me with that? And that, I think that's the advantage of using your listenership or your public in that way, is that there are some folks who are sitting in front of their machines and are not able to do the work. So let's put them to work to help us connect with people. So we haven't had that challenge. The challenge, honestly, is having the information from a centralized source in terms of statewide capacity. What kind of equipment do we have? What kind of equipment have we asked for? How many people are being tested? Like, sort of that big picture on that scale. That's really what has been the challenging part of getting the information, getting sort of baseline information.
We've had another couple of questions on the sort of physical safety front. You were talking about using boom mics and some of the other, or shotgun mics and some of the other steps you've taken. Has the station or NPR provided any kind of protective gear or any of this equipment, or is this a case where you're putting it together with bubble gum and Scotch tape and people are grabbing the gloves off the shelf? Or how's the protective gear piece of it going?
Sure. We luckily we had just gotten 3 brand new shotgun mics, so the reporters that felt like they were going to go out into the field grabbed those. The station early on got us wipes and hand sanitizer and cloths and rubbing alcohol, because you have to clean the station equipment differently. Same with the microphones. So they provided that, and same with the gloves. They also stocked the freezer with some food for the host. We got an email on that last week. So I think, and there's toilet paper, which is key. So we have that going for us. So we were in pretty good shape. You know, we were lucky that we had, you know, everybody had laptops. And just it was a matter of upgrading our software and making sure all those programs were in place. But then realizing that, you know, minimizing the amount of people in the room, in the space was really going to be the key thing to kind of easing people's minds.
And that's both a matter, we should say, of the protection for the reporters, but also not to turn reporters into super spreaders either, right? So it's really serving both. I should say that there's a very lively back and forth going on the chat now about particular gear and sources for gear that people have been using. So this has inspired a very interesting little chat in the Zoom chat space. When you have reporters who are interacting with sources in this fraught environment, as a craft matter and as an ethics matter, what have you encouraged them to be mindful of? What are the kind of ethical concerns that have been front and center for your team going into this?
Oh, that's a really good question. You know, to be honest, we haven't had any because we haven't, I mean, I think there's the double sourcing aspect of it. I mean, how do you trust what somebody is saying when you maybe can't physically see them if they're not on a video call, but how do you trust that what they said is true? Like that's probably been the hardest thing to do is if you can't physically go to a place and talk to their coworkers or talk to the medical professionals, how do you verify that the story that they're telling you about their mother is true?
And how have you handled that?
Just shoe leather, you know, trying or holding back a story that didn't have that.
What can you give us maybe an example of a time when it doesn't, I mean, the general nature of the story, at least, to make it a little more specific.
I mean, I think it's like if it was a nursing home, you know, this was a situation that reporter, he ended up working with a different editor. So I didn't work with him one-on-one all the way through, but he wanted to, you know, I asked him to find some documentation that at least acknowledged that your mom was a patient in this nursing home, short of being able to talk to the mother herself. You know, he did his due diligence to kind of fact check to see who this person was, that she really did exist, right? Because there's that aspect too, is this person who's talking to you actually who they are and where they're from?
Have you or any
medical professionals?
Have you or any Seattle news organizations gotten punked in the course of this?
No, God forbid we haven't. And that was actually the first time when I thought, well, how do we know for sure that she's a nurse? And so he went to look up to see if he could verify and, you know, checked the websites to make sure that she existed and checked her LinkedIn page and tried to find out. And then eventually, and I'm not sure how he did it, found a second person who was at the nursing home too, that had some knowledge of that this person had been in there. But that's probably the scariest thing, is that on a story this big, when everybody when there are such high stakes, that somebody's going to take advantage of you as an outlet and tell you something wrong and lead you down the wrong situation. The beauty of, I think, and probably goes without saying, is some mechanism like Slack, and, you know, we've always been the newsroom where, you know, better to ask a dumb question ahead of time than get something wrong. Those are usually conversations that come up with, say, you know, race. When, is this the right word to use? I don't know, you know, those. And so getting that, and I've certainly had my share of like, this is a really dumb question, but I don't care. And I think that's an example of trying to lead by example, is making it clear that you are asking the questions that need to be asked, and you are willing to slow down because you're not going to, one, publish something that's inaccurate, and two, there's no reason to be in that sense of urgency. In the end, you want a good story and you want it right.
What about language choices? There's an interesting question in the chat about what kind of language your reporters use. And For instance, talking about, are people sick? Are they ill? Are they diagnosed? Has someone died? Have they passed away? What kind of conversations have you had about that in your reporting?
We actually haven't had a conversation. Our initial conversation was sort of, do we say COVID-19 or coronavirus?
And how did you decide that one?
I think AP helped us out with that, or NPR guidelines maybe did that. I saw chatter once on somewhere about infected with, and we've never used that.
Well, that's a good example. Yeah.
That harkened to, there were some folks who were reminded of HIV and AIDS, and how that was, you're infected with, and we don't use that. I think
so. You are in fact avoiding stigmatizing language, and that.
Yeah, we have, without realizing that that's what we were doing. We've played it pretty straight. And just made the language more conversational when they were coming out from authorities. This is the number of cases. For a while, it was like the number of presumed cases. I think we've said, the number of people who've died. We don't really say passed away. Maybe you'd say passed away in a more narratives, in the podcast, if it was a longer story and it kind of acknowledged and you were humanizing the person. But right now there's a little bit of, the numbers that are being surfaced. And
what about numbers? I was on a call the other day with some colleagues pointing out that most of us are not exactly statistics geniuses. How have you handled within the team the numbers game, and how have you handled it in your reports? Statistics are so important to public understanding.
Yeah, they are. And I have to say, we haven't we haven't had to do those specific stories. That's really been the bandwidth of somebody like the Seattle Times, who's really has the bandwidth to do more analysis and investigative nature of the reporting. One thing that we were mindful of, and this did happen on Slack, and we were careful acknowledging, is that the numbers were going to ramp up. We knew that because the testing was ramping up. So it was diminishing that fear. And that was something we had to tackle early on, was throwing it back to the importance of hosts, and is making sure we were calm and careful, and sure, our 2.5 hours may be all coronavirus stories, but there is a huge level of responsibility when the intimacy of a host talking to you and telling you what's happening in your world. It was important to be measured and still friendly and conversational, but delivering important information.
And that in turn, when you mentioned the Seattle Times, that reminded me, and one of the listeners also, participants also reminded me, has there been much collaboration between news organizations in Seattle on this regional nightmare?
We're lucky for public radio that we're part of a Northwest News Network. So we are a collaborative partner with KOW, for example, and some of our reporters are shared. Our Olympia correspondents, for example. So we also feed into, we're working with Oregon Public Radio and some of the other stations in Oregon, in Central Washington. We've been sharing, the notion there is, share your stories so that other outlets can use them for their newscasts, web stories as well. It's interesting you brought to the Seattle Times. We had a partnership with them on a different podcast. And honestly, I've thought about reaching out to them to see, but everybody has been so like head to the ground, or just focused, that we just haven't had much of the capacity to even approach that. I think, the Seattle Times has done remarkable work, and for being in such a grim situation, it's really reassuring, and to have such a large breadth of local reporting that's happening here. We are very fortunate to have such a strong daily newspaper like the Times.
If you look back on this kind of last phase of reporting since January, and then forward to what is coming next, What, first of all, do you feel like you've been most challenged by, or perhaps least satisfied by, that you want to address in your coverage going into the next phase, do you think?
I think, sometimes in the normal days, it would be, so what are we gonna do? What are the
Mhm.
stories to do? How are we gonna fill our newscast? And sometimes there'd be stress on that, like, God, really, we have nothing interesting to report? What are we gonna lead with? And this time it's like, you could look anywhere on any
Mhm.
beat in any county, and you're gonna find a coronavirus story.
Yeah.
That's important and worthy. Um, I think what I'm really gearing up for is setting a baseline and knowing what's it going to look like in our region a month from now.
Mhm.
So you're chipping away at everything. Restaurants are closing. Kids are out of school. Are they being served their food? What's happening in the jails and things? But let's then assess, like, let's go big picture,
Mhm.
and then let's kind of look at the region, 60 days from now, on day 60,
Mhm.
what does it look like? And then, like a before and after.
Mhm.
Also, being mindful that we haven't hit all the places in our region.
Yeah.
Rural Washington, um, uh, tribal nations, what's the temperature there and what is happening there? What is life like
Mhm.
in those situations, in
Mhm.
those areas? So I
Mhm.
think I would like to make a little more inroads in that.
Mhm.
Um, that's what I'm gearing up for.
And if you were talking to an editor or producer in another region, whether it's Louisiana, Nebraska, Ukraine, that is now at the early point in this arc that you've lived with for a couple of months, what would be your top bit of advice as they head into this? What would you say is the most important lesson learned?
You definitely need to have your list of agency phone numbers, mobile, all the statewide or whatever, the most important emergency responders list, for
Mhm.
sure. Have that crafted already. I
Mhm.
think I would set up some sort of hyperlinks, some resourcing that, especially if you have a website that you could
Mhm.
send people easily
Mhm.
to, and just keep that updated. And three, I think the engagement aspect is really key. And I think being willing to quickly take people off of their beats,
Mhm.
or giving them new roles or tasks. And honestly, even pulling and asking for help outside of the newsroom.
Mhm.
Um, I was lucky that people in development and people in other parts of the organization, everybody wants to help, I think.
Mhm.
And so can you harness that energy, both
Mhm.
inside your organization, but outside in your community?
Yeah.
Can you harness it in the way that you're seeing um, communities already reacting? I'm
Mhm.
serving food, I'm delivering food, Meals to Wheels. Like, you're seeing people really eager and hungry to help. I think there's a way to tap into that as a newsroom. And I think the smaller and smaller you are, that's an opportunity to ask listeners or readers, how can you help us?
Mm.
We don't benefit from something like Harkin, which I
Mhm.
know is a tool, and it's a great tool, but it's an expensive tool, and we don't have that.
Mm.
So we've gone old fashioned, old school.
Mhm.
What do you want to know?
Mm.
Can you help us with this? Send
Mhm.
us a voice memo. Here's how you do it. Sometimes old school and is fine.
Yeah.
Sometimes it works.
And a final sort of craft question. This from my friend Scott Blanchard, who's a public radio producer in Pennsylvania. How have you balanced handling breaking news, literally the allocation of station resources between breaking news and the longer range and long form podcasting, and how have you made peace with the physical limitations when you can't get the audio, natural sound, all of that? How are you how are you handling those kinds of craft challenges going into this next phase?
Yeah, that's a great question. I knew that I could not get frustrated with reporters who didn't want to go out into the field, right? Like I knew that I was never going to be cranky about that, because you always want your reporters to, you know, get that audio. But I think good conversations, you can get that intimacy having phone tape, people to recreate scenes, get people to walk around their house, get that kind of sense. I think there's no question that we made the right decision to switch our podcast team from what they were doing, sound effect, to transmission, and we're in that for the long run. I think it's a matter of, I'm at the point where I know that people are going to need time off. So my team might get a little smaller, but I think you just make do with what you have. And my hope is that if reporters need some time off for their mental health or physical health, or just because they were supposed to take vacation, that you can be sure that on day one when they're back, they're going to have a whole bunch of stuff on their plate to chase. But I think this is a story of a lifetime, right, of our generation. There's no more important thing to be doing right now, and there is something really humbling about being able to be a journalist, and the responsibility that we are presented with, and the responsibility that we need to serve. And certainly we've gotten a lot of thoughtful emails from listeners who have appreciated what we're doing. And I love that journalism is getting that kind of attention, that outlets are being appreciated. And I'm just really proud that to be a journalist and to have a team of people who are all committed. I think this is what got us into the profession. This is what keeps us in the profession. This is what pulls us back into the profession, even when we go and get jobs that are better paid and less insane on our work-life balances. But this is if you're a journalist, this is the story that you want to be on, and you're going to pour your heart and soul on it, and hopefully you're surrounded by people who will help you maintain some sanity, and ask smart questions and have your back throughout, so that so we can deliver, you know, the best thing that we can.
Well, thank you for that, Florangela. We'll end there. I can't imagine a better place to end. We've been with Florangela Davila of KNKX in Seattle. KNKX.org is the website. I'm Bruce Shapiro from the Dart Center for Journalism and Trauma. This Zoomcast Facebook Live event is also co-sponsored by Columbia Journalism Review. I want to thank Kyle Pope, the editor of Columbia Journalism Review, and his staff, my colleagues Kate Black and Ariel Richin on the Dart Center team at Columbia University in exile in New York City and elsewhere. And all of you who have joined today and contributed questions, not all of whom we were able to get to. We'll be back next week on Tuesday and Thursday with the next installments in this ongoing conversation for our community as journalists around the world about covering coronavirus pandemic. Thank you all.
Thank you, Bruce. Thanks for everyone who chatted and participated. And if you can listen to transmission, we'd love your thoughts, because, well, we can do better if you tell us how to do better. So thank you.
Thank you all.
Stay safe, please.